السلام عليكم. أنا اسمي معاذ وطالب طب وتابع لإنسجن، ومعايا هنا أحمد.
أحمد المبري، طالب كلية الطب البشري طبرق، وإن شاء الله اليوم حنتحدث عن تروما and injury in Libya.
So this picture is from Benghazi Medical Center this summer. It's a patient who got involved in a motor vehicle accident on his way to Marj, and then unfortunately he was taken. Unfortunately, he ended up in the accident and then was taken to the closest or the major trauma center, that is Benghazi. This is a laminectomy operation, so he had spinal cord injuries. This is unfortunately a very common scene in Libya, and we will see a little bit more about it. Injuries are responsible for 10% of all deaths worldwide. You can divide injuries into different categories. Car crashes are part of them. Someone dies from an injury every 5 seconds. More than 15,000 people die as a result of injuries every day, and about 5.8 million people die from injuries every year. So they kill 32% more people around the world than malaria, tuberculosis, and HIV/AIDS combined. So as we talked in the previous lectures about the global burden of disease, we can see that injuries are a major burden around the world. And then when we go look into road traffic injuries, because of course, not all injuries are due to vehicles. It could be due to war, it could be due to homicides and so on. But let's focus a little bit about the road traffic injuries. We see that approximately 1.3 million people die each year as a result of road traffic crashes. They cost most countries 3% of their gross domestic product, so the GDP. It's very expensive. More than half of all road traffic deaths are among vulnerable road users, so people who walk, cycle, or drive a motorbike. 93% of world's fatalities on the roads occur in low and middle income countries, even though these countries have approximately 60% of world's vehicles. Road traffic injuries are the leading cause of death for children and young adults aged 5 to 29. And men are, of course, heavily overrepresented in this statistic. You can imagine why. Some risk factors in traffic injuries or traffic accidents: speeding, alcohol, drugs, non-use of motorcycle helmets, seat belts, and child restraints. So, for example, wearing a seat belt reduces risk of death very much. There are different numbers for it, but at least,
15%.
yeah.
Okay.
So then we have risk of death and serious injuries. It's very high if you sit in the front seat. And then another reason for crashes is distracted driving. You're being on the mobile phone or somebody else's, and there are, or for example, there's discussions, or you get distracted for other reason. Then infrastructure, unsafe vehicles, inadequate post-crash care, so that's the healthcare system, and then inadequate law enforcement of traffic laws. There is nobody who checks on you or on the road. It's also very common that, for example, you have long roads without any light. يعني هذه أظن في ليبيا هذه مشكلة كبيرة، يعني فيه مسافات طويلة
طرق الزراعية صح.
وحتى على الداخل ما فيش أي ضي، يعني يقعدوا في ظلام يجروا. So that's very, very dangerous. Then we have some statistics from the WHO, الصحة العالمية. They tell us, they came out with a report in 2018 on road traffic deaths. And then we can see here that in Libya in 2016, based on Libya's own statistics, 39% of those who died on the road were driving a car. And then 36 were passengers in the car. and 21% were people who were walking on the street. So you can imagine that this is a big percentage, considering not that many people walk on the streets on faraway areas. You have cyclists and then motorbikes as well. Then when you look at the trends in reported road traffic deaths, so it's very common that death is reported as per 100,000 population. We will later delve deeper in this statistic or this unit, but it was, according to the Libyan statistics in 2008, it was nearly 45 per 100,000 who died in Libya because of road traffic. Then in 2011 it dipped, and then it went back up again. In 2013 it was up to even 60 deaths per 100,000. And then we can see that the WHO has lower estimates. So here, down here, if you see, the WHO estimates that it's 26 people die per 100,000. But I think we are much closer to the Libyan statistics, unfortunately, than the WHO. Here is some calculations again. So I repeat here, on WHO statistics, we have 26.1 accident deaths, this is not accident, deaths per 100,000 Libyans. And it's calculated based on number of deaths divided by population times 100,000. But however, if we calculate based on 2018 data, based on the Ministry of Interior of Government of National Accord, and then Municipality of Benghazi and other cities, if we calculate them, we get a statistics that are very terrifying. So between 50 to 70 traffic deaths per 100,000. And then I put it here in the international ranking of deaths in traffic, and we see that Libya unfortunately tops the list. So these are WHO rates, and this is the calculated Libyan rate. It could be also, of course, that they have also underestimated the number of deaths in these countries, but I doubt so. None of these countries have an ongoing conflict except Central African Republic, and they get lots of support with the statistical work from the WHO. So Libya is probably underestimating the statistics. Unfortunately, it's very high. So we can conclude here that the traffic deaths and injuries, they are a major public health problem in Libya. The country is on top of the world when it comes to traffic injuries and deaths. Reasons are many. We went through the risk factors, but we all know that Libya has a high percentage of bad cars and roads. There is reckless behavior, long dark roads, and yeah, high ratio of cars.
والحزام safe belt.
صح. And then we can see here from an article in 2019, we have that 2005 people died in 2018. So this itself is much higher than the WHO estimate. And then there was another news article that the roads are deadlier than guns in Libya. Here is another example. I mean, you see these actually very often, news articles about traffic accidents and traffic deaths, but you don't, يعني تمشي، يعني هنا مش موضوع تفكر فيه واجد تحس هيك موضوع حادث وخلاص، لكن لما تفكر شوية بعمق أرقام مرعبة راه ليبيا. Yeah, so here's, for example, an article about traffic deaths in Misrata, and then if we calculate quickly, we reach that it's 42 deaths per 100,000, which is also very, very high. This would be this is again on top of the world list. There is some Libyan research on traffic deaths, but they often have a lot of limitations and are clearly not well funded. يعني, they are small studies, they are small case reports, there is nothing national, it's very limited on one road or on one hospital or district in a city and so on. So it's very limited, as you can see. أنا صبراته. Here's طريق بين جدابية وبريقة. And most of these studies, they've been done by Libyans in foreign universities, يعني في قبرص أو ماليزيا أو مصر. And many of them are also based on old data, يعني من 2000 في اللي مستعملين 2005 2006 2010 إحصائيات قديم يعني. Which is, I mean, it's still good data most probably, but the situation has worsened with the traffic accidents. We can take a case example here. شهر 7 في بنغازي السنة هذه 44 وفاة بسبب حوادث السيارات. رقم مرعب. We can see that it's approximately, assuming that the population of the Benghazi city and the metropolitan area is 850,000, and this could be even higher. It's 60 deaths per 100,000, which is extremely high value. And this is, for example, an accident from a few weeks ago. This is not a new thing. Libya has always had a very high rate of deaths due to traffic. This is, again, mainly because pretty much everybody owns a car, and then long roads, no infrastructure, and people just drive. Did you know, for example, that the road طريق الساحلي طبعا بنينه الطليان من وقت الطليان, so it's been there for a long time, and in some parts of the road it's very, very dangerous. It's not supposed to be for 20th century, but it hasn't been renovated or so in many places. بعدين كان أحمد تبي تزيد على الموضوع.
ده هو يحكي على في الصورة هنا spinal cord injury. ففي ليبيا زي نشوف اللون الأبيض يدل على أن الحالات يعني عالية جدا، يعني من 33 أو إلى 24. فمعدل كبير باعتماد لكل 100,000، يعني كل 100,000 من السكان في عام 2016 طبعا استاديا.
صح.
ويحكي أنا على السباينال كورد انجري يعني بالخصوص، يعني هو الموست كومن كوز للسباينال كورد انجري اللي هي الار تي اي يعني.
بعدين
تروماتيك برين انجري كذلك، تي بي اي، حتى يلي في الانسيدنس تروماتيك برين انجري عالي جدا، يوصل لي من 400 إلى 500 حالة لكل 100,000. هنا زي نظام ديرت WHO في 2017 كيف تحافظ على حياة lives of road safety technical package with the scientific evidence-based measure that can be significant and reduce road traffic fatalities and injuries. فيحكوا لك على السبيد، تقلل السرعة، أول شيء تعالج السرعة، بعدين الحاجات الأخرى. لكن اللي يهمنا في الصحة اللي هي البري هوسبيتال كير، كيف تسعفه يعني بطريقة إيش بحيث يوصل للمستشفى ويبدو المانجمنت بتاعه يعني يكون إيش زي ايفالويشن وستابلايز للسباين، وكيف تنقله ضروري تكون بطريقة إيش نظام يعني يحدد من المستشفيات يعني. أنا اللي يحكي لك على المانجمنت أو how to approach to the spinal cord injury. فأول شيء تدير evaluation وتدير diagnose الحالة في مكانها قبل ما تشيل، لكن ضروري قبل كل شيء تدير اللي هي الاي بي سي دي اي، اللي هي الابروش عن طريق الاير واي والبريثنج والسيركوليشن، اللي هي زي البروتوكول المخصص للسباينال كورد انجري. بعدين تبي تدير له ستابلايز للسباين باللوج رولينج اوف ذا بيشنت من غير ما تحرك اي شيء، وبعدين تبي تنقله المستشفى وتبي تبدا ايش معاه بالدياجنوستس، هي نيورولوجيكال اكزامينيشن وتدير صور سي تي ام ار اي وغيرها من المانجمنت اوف ذا انجري للسبينال كورد. تمام، كمل هذه معاذ.
تمام. بعدين عامة لما كل دولة يكون فيها تراوما سيستم واضح، يعني بأن مثلا ليبيا تهيالي حاليا المستشفيين اللي متكفلات بالتراوما بنغازي وطرابلس، مش متأكد، ممكن مصراتة يكون فيها أيضا، بحجة بأن حتى هم عندهم جراحة أعصاب وجراحة قلب أظني، لكن هن الرئيسيات اللي أعرفهن هن بنغازي وطرابلس. وكل دولة تحتاج يكون عندها تروما سنترز، لكن المهم أيضا يكون فيه
أخصائيين كذا.
أيوة، ويكون في شغل، يعني مثلا صيادة الإسعاف أو يكون في طيارة إسعاف يمشن على طول المكان، يعني يديروا ريفيرال سريع وبطريقة منظمة. فلما يكون عندك سيستم منظم يعني للتروما مانجمنت فيها نقص، there is a reduction in mortality، هذه عارفينها يعني. وأيضا بأن إذا يكون فيه سيستم للتروما مانجمنت هذه أيضا تدير تنقص medically preventable deaths by 50%. So it's important to have a good trauma system that can take care of patients, that activates itself quickly, and that can stabilize the patient very fast on the way to the hospital. So as you can see, it's a multifactorial thing. You need to have good ambulances, you need to have good staff, and so on and so on.
المؤشرات الستة اللي حكينا عليهم في
صح.
في الجلوبال سيرجري، اللي هي يكون في 20 أخصائي لكل 100,000 وغيرها، 6 مؤشرات انديكيتور لنا مهمات يعني توفروا في البلاد. تمام.
وأيضا مهم للدولة بأن تشتغل على مواضيع طبعا الانفراستراكشر والطرق وتوعية الناس، شغل مهم يعني. بعدين
هذه ستادي جلوبال نيورو سيرجري، طبعا هي انترناشونال، هي انجوينج ريسيرش حاليا، وليبيا مشاركة في البحث هذا ب5 مستشفيات، مصراتة وطرابلس وطبرق، تقريبا مستشفيين من بنغازي لا، طرابلس مستشفيين ومصراتة تقريبا 2، لكن بنغازي تقريبا مش داخله في الاستادي هذه. فان شاء الله نشوفوا الكونكلوجن او الارتكلز بعد سنه باذن الله، يعني في 2021 متوقع نشرها في مجله كبيره، يعني تكون استادي كويسه، يعني تقدم يعني ايش حاجه جديده يعني في جلوبال نيورو سيرجري. وفي تقريبا بحث اخرى حتى هو تابع لكامبريدج، حتى هو تقريبا مشارك في اكثر مستشفى في ليبيا. فان شاء الله نشوفوا يعني مشاركات ليبيا في الاستادي هذا يكون لهم دور كويس يعني في تحديد الداتا، يعني خصوصا ما عندناش اي بيانات نحن على ليبيا من 2006 او قبلها.
ما شاء الله شغل كويس والله. تمام. هذه المحاضرة على التروما وليبيا. أتمنى بأن
ونحن حكينا أكثر شيء على الار تي اي لأن أكثر سبب، لكن في أسباب أخرى اللي هي جان شوت وغيرها من أسباب التروما والسقوط وغيرها، لكن حاولنا نركز في المحاضرة دي على الار تي اي، يعني لأن إيش هي most common cause the death in the Libya.
صح. صح. حلو. تمام.